Hi, my name is Gretchen Spadinger, and this is my final presentation for Nursing 802, Translating and Integrating Research into Nursing Practice. This evidence-based practice project aims to answer the question, in patients after cardiac surgery, how do timed reminders for incentive spirometry use compared to standard use affect the need for supplemental oxygen? The use of an incentive spirometer is standard practice for preventing postoperative respiratory complications. After cardiac surgery, respiratory complications often require the use of supplemental oxygen and can significantly extend a patient's length of stay. It is standard practice to recommend that patients perform incentive spirometry exercises 10 times per hour while awake, but adherence to this practice can vary greatly. In a randomized controlled trial, set timed reminders for IS use for patients after coronary artery bypass grafting were shown to increase patient adherence, decrease atelectasis severity, decrease ICU length of stay, decrease hospital length of stay, and decrease 6-month mortality for cardiac surgery patients. This is a significant topic because worldwide over 1 million CABG procedures and additionally over 200,000 valve replacement surgeries are conducted on an annual basis. Many of these patients, about 30 to 60%, will develop some sort of respiratory complication. These respiratory complications can lead to poorer patient outcomes, including increased morbidity, increased mortality, increased length of hospital stay, and increased healthcare costs. So for this evidence-based project, the question that we are trying to answer is, in patients after cardiac surgery, how do timed reminders for incentive spirometry use compared to standard use affect the need for supplemental oxygen? We conducted an extensive literature search through the CINAHL and PubMed databases and used the keywords for population of cardiac surgery, coronary artery bypass graft, thoracic surgery, surgery, and sternotomy. For our intervention keywords, we used incentive spirometry or incentive spirometer, compliance, and reminder. And the outcomes keywords that we used were pulmonary complication. Our results were limited to primary sources, so we excluded care guidelines, literature reviews, and meta-analyses, and we limited it to articles published after 2010. As a result of our search, we obtained 3 primary research articles that were pertinent to this PICO question. Each of the retained studies aimed to evaluate the effects of reminders for incentive spirometry use on compliance and on rates of postoperative pulmonary complications. The first article by El Toray et al. From 2019 showed that Bell reminders for incentive spirometer use after coronary artery bypass graft surgery decreased respiratory complications as measured by an atelectasis score, rates of early post-op fever, and use of non-invasive positive pressure ventilation. These Bell reminders also decrease ICU length of stay and 6-month mortality rates. The next article by Al-Wakayan et al. From 2021 showed that timed reminders by nurses for incentive spirometer use after CABG surgery increased the frequency of IS use, decreased the number of hypoxic events, decreased ICU length of stay, decreased overall hospital stay, decreased rates of post-op pneumonia, and improved results on pulmonary function tests. The last article, although this was not pertinent to cardiac surgery patients, it did include information on a mobile app called the GoBreath app that included timed reminders for incentive spirometry and was used studying gastric cancer surgery patients. This study by So et al. In 2019 did not show any improved rates of IS compliance, although this was self-reported within the app. And did not show an effect on white blood cell count or rates of post-op fevers or hospital length of stay after gastric surgeries. For all EBP projects, it is important to incorporate clinical expertise into the project. Care collaboration is an approach that aims to bring multiple healthcare professionals with different backgrounds and areas of expertise together to provide the highest quality patient care possible. Practice expertise comes from providers' past practice, experience, collective wisdom, and care standards. For this project, our key stakeholders are the cardiac surgeons, PAs and NPs, bedside nurses in the cardiothoracic IMC, and it is important to engage these key stakeholders earlier in their project to ensure engagement and to gather information on how timed reminders for use of IS will be implemented and monitored. All patients bring with them a set of personal beliefs and preferences based on their cultural, religious, family, and personal backgrounds, which affects their healthcare preferences. It's important to incorporate these personal preferences into healthcare decisions to ensure that their care aligns with their beliefs. For example, most patients would not prefer to receive reminders for IS use while sleeping. But there may be also some other times, according to religious or cultural customs, when timed reminders would not be appropriate. Therefore, it is important to incorporate these patient preferences into the project. The evidence-based practice model that we use for this project is the evidence-based advancing research and clinical practice through close collaboration, or the ARC model. And this model was used to help facilitate the implementation of this project. The ARC model uses evidence-based practice education, skill building, and mentors to help persuade clinicians that EBP is valuable in improving patient outcomes. Through this, clinicians have an enhanced evidence-based practice competency, increased ability to implement EBP, increased job satisfaction, improve patient outcomes, quality, safety, and satisfaction, and overall decreased health system costs. For every evidence-based project, it is important to obtain a clear measurement of outcomes before and after the intervention to determine whether or not the intervention has an effect on the desired outcome. The use of supplemental oxygen is already documented by nursing staff and can be easily monitored and measured through chart review. Baseline measurement of the need for supplemental oxygen, including the amount and duration after cardiac surgery, will be obtained by the nurse leader through a chart audit. Project leaders will compare baseline data to post-intervention data to determine whether timed reminders of use of IS has an impact on the need for supplemental oxygen after cardiac surgery. To ensure sustainability and buy-in from key stakeholders, evidence-based education and skill building by the nursing leadership and our unit-based educator will be provided to all the nurses on the unit. And nurses that show an increased investment in the project will receive additional evidence-based practice training and service project-based EBP mentors. For the next section, dissemination of evidence allows clinicians to share valuable information, make recommendations for further EBP projects, and ensures that patients are receiving care that is backed by sound evidence. To disseminate evidence from this project, we plan to present the evidence in a roundtable discussion held during regularly scheduled staff meetings. These meetings occur both in person and virtually and can also be recorded for future viewing. We will also present our evidence in a poster format that will be posted in the unit and readily available to all nursing staff members that are unable to attend the staff meeting. In conclusion, many people across the world will undergo some sort of invasive cardiac surgery in the upcoming year, and a large portion of these patients will develop some sort of pulmonary complication postoperatively. These pulmonary complications can significantly impact patient outcomes and hospital length of stay, leading to increased resource use, and increased healthcare costs. Previous research has shown that timed reminders for IS use may increase patient compliance and adherence and decrease rates of postoperative pulmonary complications. The aim of this EBP project is to determine if timed reminders for IS use will be beneficial in reducing the need for supplemental oxygen on the unit after cardiac surgery. By incorporating the ARC model, clinician expertise, patient preferences, and planned dissemination of evidence, the project aims to achieve buy-in from key stakeholders. If successful, this project may indicate that timed reminders for IS use may be effective at reducing the rates of postoperative pulmonary complications and reducing hospital length of stay after cardiac surgery for our patients. And here is a list of references used for this project. Thank you.